reports of depression worsening the past 3 months. She has increased fatigue, and she's not been going places or doing anything. She also has back pain that has increased, and she finds it difficult to do the dishes because of the pain and fatigue that she's been reporting. She also has been having panic attacks, which are new for her. During the panic attacks, she's short of breath, has palpitations, shakiness, and sweats. She reports that they last 5 to 15 minutes and then resolve, leaving her exhausted. She also reports a decreased appetite, but she's unsure of that. She thinks she still may be eating as much as she has in the past, but states that she can't tell. She does report weight loss. Her past medical history includes gestational diabetes. She's followed in the office for those, and her blood sugars have always been normal. She has indigestion. She's never been hospitalized for psychiatric reasons or any other reasons besides her 2 surgeries in the past, which include an appendectomy in 1992 and cholecystectomy in 2000. She also has been hospitalized for childbirth. She has a 10-year history of depression. Her current medications include Zantac 2 to 3 times a week. She does take Tylenol and Advil for her back pain as needed, along with Tylenol for headaches and muscle relaxers for the back pain as needed. She's on Ultram for the back pain just for when it flares up. And it looks like her last Ultram prescription was 3 months ago, and it was for 30 pills. She also takes Prozac, 20 milligrams per day for her depression in the past, and was switched a year ago to Cymbalta because of her chronic back pain. Her husband died 3 years ago. She has 2 adult daughters that live nearby. She owns her home. She was a stay-at-home mom and has not worked since her youngest daughter was born. She used to babysit her grandbaby in the mornings, but she states that she is too nervous to do that anymore. She does not smoke, but she does drink 3 cups of coffee a day and a Mountain Dew. She denies street drugs, and she does not exercise regularly. She denies chest pain, except during her panic attacks. She denies dizziness, but she states that she is irritable pretty often, and she's never had high blood pressure. She's not had any nausea, vomiting, but has intermittent indigestion. She admits to urinating small, frequent amounts and the feeling of urgency. She's had this for a couple of years, but it's getting worse. On physical exam, she's 129 pounds at her last visit, and she is now 119 pounds today. Her temp is 99.2, her pulse is 94, respirations are 22, blood pressure is 128/82. She does appear anxious when I talk to her, and she speaks rapidly when I ask her questions. Her eyes, nose, throat are normal. I do feel a slight fullness in her neck, I think, but I'm not sure. She has no nodules that are palpable. Her lungs are clear. Her heart rate is rapid but regular without murmur. She has no peripheral edema, and her pedal pulses are +2 bilaterally. Her abdomen is soft, non-tender, and she has positive bowel sounds throughout. She does have fine motor tremors. My first differential diagnosis for her is going to be a panic attack. Although panic attacks are not likely after the age of 45, she's presenting with all the symptoms of panic attacks, and it's unknown if she's had panic attacks in the past. So that is probably something that I need to ask her with her history of depression. With her stating that she used to babysit her grandbabies in the morning, but she's too nervous to do that anymore. Her rapid heart rate, anxious appearing, and speaking rapidly. And she is stating that she's having panic attacks with all the symptoms of a panic attack, including shortness of breath, palpitations, shakiness, and sweats. And she does say that they last 5 to 15 minutes and resolve on their own, leaving her exhausted. I need to draw labs on her to rule out other causes, including a thyroid panel, electrolytes, and an ECG. And start her on an SSRI. Encourage her to decrease her caffeine intake and also start exercising regularly to help decrease her panic attacks. My second differential diagnosis for her is going to be a hyperthyroidism with her slight fullness in the neck, tremors and anxiety and panic attacks, irritability and weight loss, her rapid heart rate and fatigue. Although she states she's had a decrease in appetite, she also states that she's unsure of that. And with hyperthyroidism, you can see the appetite not change, but she has had a weight loss. Lab tests that need to be run need to be a T4 and T3. If those are elevated, I would have her do a 24-hour radioactive iodine uptake study. Discuss treatment options with her after a positive diagnosis with the labs and the iodine study. Treatment options include radioiodine, anti-thyroid drugs, or surgery. She will also require lifetime monitoring for reoccurrence if her tests come back positive. Mr. D is a 59-year-old incarcerated male who comes in complaining that he was seen 3 weeks ago for allergies causing him a lump of phlegm in his throat that he couldn't shake. At that point, he was given Flonase and asked to return for a follow-up in 3 weeks, which is why he's being seen today. Today, he is complaining of dysphagia. He reports having weight loss, some fatigue. He also reports having difficulty eating, but is able to swallow fluids fine. He states that he has to chew his food a lot before he goes to go down and feels like sometimes it gets stuck in his throat. He has a history of GERD, which flares up 2 to 3 times a week, and he currently takes Zantac for that. He used to take Prilosec, but the prison, it isn't on the prison formulary. He can purchase it on his own, but doesn't have the money for that. He had an AGD about 10 years ago for that, which was within normal limits from what he can remember. He also has type 2 diabetes, which is in control, which he takes metformin for, and his last AIC was 6.4% 2 months ago. He has a history of hypertension, which is controlled with lisinopril. The only other medication that he's on is Hitrin, 2 milligrams at bedtime for his BPH, which has been working well for him also. His only past medical history other than that is that he had an appendectomy at age 14 and also had multiple gunshot wounds to the abdomen at age 29. He denies nausea, vomiting, diarrhea, or constipation. He did have a significant alcohol intake over many years and is a smoker, 1 pack per day for 45 years. At his last visit, he was 5'10" and weighed 168 pounds, and at this visit, he weighs 169, so he's not really had any weight loss. His blood work at his last visit showed normal chemistry panel, including liver and kidney functions. His vital signs today are temp of 97.8, pulse of 68, respiratory of 20, and a BP of 116/78. On exam, he is alert and oriented. His ears, eyes, nose, and throat are unremarkable. His lungs are clear. His heart rate has no murmur, rub, or gallop. His abdomen soft, tender, and bowel sounds are positive ×4. He has no peripheral edema, and his pulses are positive 2 throughout. My first differential diagnosis for him is going to be a GERD flare-up. Just with his difficulty swallowing food and his past medical history of GERD. Also, metformin can kind of add to indigestion problems that go along with GERD. I would go ahead and get another upper GI for him and note the extent of his tissue damage and rule out any other causes that may be causing his dysphagia. He needs to be educated on lifestyle modifications, avoid foods that are high in citrus, carbonated beverages, spicy foods, and caffeine, along with smoking can increase the problems that he's having with GERD. I also would like to look into getting Prilosec covered for him since there are no other over-the-counter medications with the same active ingredients, and maybe see if getting him back on Prilosec can clear up the GERD. My second differential diagnosis for him would be H. pylori. He does report weight loss, although that's not seen today. And his weight from 3 weeks ago, he's actually up a pound, but he does state that he feels like he is losing weight. The dysphagia goes along with the H. pylori, and although scoping is not recommended to diagnose H. pylori on its own solely, with his history of GERD, again, I would go ahead and scope him to rule out the H. pylori and see if there's any other cause that can come from that. I would also do a urea breath test and a stool antigen. If he is diagnosed after the scope with H. pylori, along with the other testing, I would start him on a PPI twice daily, along with chlorothromycin. Mr. G is a 36-year-old Hispanic male who is being seen today with complaints of a persistent cough for the last 3 months. He reports night sweats, but has not taken his temperature, so he's not sure if he's had a fever or not. He does feel like he's been fatigued, but he started a new job 3 months ago working in a warehouse with high temperatures and a lot of overtime, so he thought maybe he was just tired from that. The cough is most of the time dry, but some of the times he said he coughs up clear sputum. He states that he thought that it might be his allergies because he's had a stuffy nose as well. He's had allergies for years, but the cough was never like it is now. He had asthma as a child, but states that he grew out of it. His current cough is not getting any better or any worse. He has a history of smoking, but states that he quit 6 months ago. He did smoke a pack a day since he was 16 years old. He has a history of high blood pressure, but that's well controlled with his lisinopril 20 milligrams a day. That's his only prescription medication that he takes. He denies chest pain and wheezing, but states that he does occasionally get short of breath with exertion. He denies nausea, vomiting, diarrhea, constipation, and heartburn. He does live with his girlfriend and 2 children. And his girlfriend and her 2 children, and they have 1 child together. He has not had any recent exposure to contagious illnesses, including tuberculosis. He does have a family history of hypertension and asthma, and his maternal grandmother has type 2 diabetes, and his mother also has migraines. He's from Texas, but was born and raised in Mexico. His vital signs are weight 180 pounds. He is 5 feet 11 inches tall. His temp is 99.2, pulse 72, respiratory 18, and his blood pressure is 134/84. So he does have a slight fever. On examination, his nasal turbinates are gray and boggy. His pharynx is injected with clear postnasal drainage. He has no sinus tenderness or lymph nodenopathy. His lungs are clear to auscultation, and his heart is regular without murmur, rub, or gallop. His abdomen is soft and non-tender, and he has no peripheral edema. My first differential diagnosis for Mr. G is asthma, and that is because of his past medical history of asthma as a child, which he states he outgrew. He does have a family history of asthma. Along with a cough. He was a smoker up until 6 months ago, and he has been getting short of breath with exertion. He does have new exposure to irritants that could cause his asthma to flare up because he is now working in a factory in extreme temperatures. Lab testing would include an ABG, a CBC, and spirometry. Instruct him to avoid triggers. Prescribed a short-acting, beta-selective adrenergic agonist for him, and to use as needed an inhaled steroid until his his asthma symptoms are better controlled. My second differential diagnosis is going to be allergic rhinitis. He also does have a history of allergies. He's got postnasal drip. He's got a cough that is dry most of the time, and he has been coughing up some clear sputum. His nasal turbulence are gray and boggy, which would lead me to believe he has allergic rhinitis. He states that he has a stuffy nose as well, and that the cough that he has is different from coughs that he's had in the past, but he has been exposed to new irritants with the job again. I would prescribe a topical steroid, fluconazole, 2 sprays to each nostril once a day, and inform him that he may not see relief until after a week of use. I would like to see him back in the office after about a week to see if his symptoms have gotten any better. You would definitely want to follow up with any new symptoms, increased work of breathing, shortness of breath, having any increased problems breathing, anything that would cause him any additional respiratory distress. He would need to be seen right away or go to the emergency room.